As discussed earlier, during locomotion and movement, the bones are the levers, the muscle is the effort, and the joints are the fulcrum. So, in an adult human being, the skeletal system, which consists of the bones and the cartilage, performs various functions. Some of the functions of the human skeletal system, which includes the 206 bones in adults, are it provides a rigid framework to the body, एक ऐसा ढांचा जिसके ऊपर muscles attached है. It also provides protection to the internal organs. Some of your bones, which are there in your ear, they help to hear. Bones contain red bone marrow, and the red bone marrow helps in blood formation. It's a hemopoietic organ. We divide the human skeleton into two parts, the axial skeleton and the appendicular skeleton. The axial skeleton consists of the 80 bones, appendicular skeleton consists of 126 bones. The axial skeleton consists of the skull and the vertebral column and the thoracic cage, whereas the appendicular skeleton consists of the girdles and the limb bones. According to the latest circular, in the skull, the hyoid is not considered as a bone of the skull. The skull consists of two parts, the cranial bones and the facial bones. The cranial bones are eight: step of sphenoid, temporal, ethmoid, parietal, occipital and frontal. इसमें से टीपी टेम्पोरल एंड parietal paired है, बाकी सारे unpaired है. The bones of the these are the bones of the cranium. The facial bones are 14, and I have given you a short mnemonic for that. Virat cannot make my pet zebra laugh, जो आप अपने नोटबुक में देख के आप पता कर सकते हैं कि इसका मीनिंग होता है वोमर, कॉन के इंफीरियर नेजल कॉन के, मैक्सिले मैंडिबल, पैलाटाइन, zygomatic and lacrimal. कौन से paired and unpaired है? We have mentioned it over here. So the details are not there very much. So you're supposed to remember the labelings and the names that I just mentioned. There are ear ossicles which are 6 in number, a pair of malleus, a pair of incus and the pair of stapes. सबसे छोटा बोन जो है बॉडी का वो स्टेप्स है. हायोइड हमारे नेक रीजन में, and it is between the mandible and the larynx part. It's a U-shaped bone, and it provides surface for the attachment of tongue muscles. Hyoid is not now considered as the bone of the skull. The human skull, the occipital bone, has a foramen magnum, and on the either side of the foramen magnum, there are two small outgrowths which are called as the occipital condyles. That is why the human skull is called as dicondylar. Another part of the axial skeleton is the vertebral column, which consists of bones called as the vertebrae. Now, during the fetal stages, we have got 7 cervical vertebrae in the neck region, 12 thoracic vertebrae in the chest region, 5 lumbar vertebrae, 5 sacral vertebrae, and 4 coccygeal vertebrae. So it is C7, T12, L5, S5, and CO4. But in an adult, the five, the five sacral vertebrae fuse to form one sacrum, and the 4 coccygeal fuse to form one coccyx, making the total number of bones reduced to 26. Among all these vertebrae, the lumbar vertebrae is called as a typical vertebra. Among the cervical vertebrae, which are 7, the first one is called atlas and the second is called axis. The axis has a condyle outgrowth which fits into the atlas to form a no joint. The atlas, the first vertebra, articulates with the occipital condyle of the skull and it results in the formation of the yes joint. So cervical first and the second vertebra are involved in the formation of the yes and the no joint. Yes joint with the occipital condyles of the skull and no joint with the atlas and the axis, that is the atlanto-occipital joint. The thoracic cage consists of the sternum and the 12 pairs of ribs. The human ribs are considered to be bicephalic because dorsally, ये एक समझो ventral और ये पीछे dorsal. Dorsally they articulate with the thoracic vertebrae at two regions. So it's a bicephalic vertebra. The 12 bicephalic ribs. The 12 pairs of ribs. The first 7 pairs are called true ribs because they are connected to the sternum. Sternum, that is the breastbone. It is a ventral bone along the midline of the chest. The first 7 pairs of ribs, by their own hyaline cartilage, are connected to the sternum. The 8th, 9th, and 10th pair of ribs do not directly articulate with the sternum, but they articulate via the costal cartilage of the 7th rib. ये जो यहाँ पे white दिखाई दे रहा है, ये costal cartilage. Whereas the 11th and the 12th pair of ribs, they are not connected to the sternum at all. That is why they are called as the floating limbs. So that was about the axial skeleton. With regard to the appendicular skeleton, it consists of the girdles and the limbs. The girdles are pectoral girdle and the pelvic girdle. Remember, the girdle connect the limbs to the axial skeleton. The pectoral girdle, that is the shoulder wala part, it connects the forelimbs to the axial skeleton. And the pelvic girdle connects the hind limb to the axial skeleton. The pectoral girdle consists of the clavicle and ये पीछे की तरफ जो triangular bone है उसको कहते हैं scapula. The clavicle is S-shaped, thin and an elongated bone, and it articulates on one end with the sternum, and on the other end it articulates with the acromion process of the scapula. Scapula is a triangular flat bone between the 2nd and the 7th rib, and it shows the presence of an acromion process which is called as the high end of the shoulder. Okay. On its lateral margin, it shows the presence of a glenoid cavity, and the glenoid cavity articulates with the head of the humerus to form the ball and socket joint, that is your shoulder joint. Another process in the clavicle is a coracoid process, which looks like a beak of a crow. Pelvic girdle, or commonly called as the hip girdle, consists of two halves, or the two coaxial bones, and each half is a fusion of three bones: ilium, ischium, and pubis. When the two pubic bones meet each other, there's a cartilage over there which forms the pubic symphysis. The fusion of the ilium, ischium, and the pubis results in the formation of a cup-shaped hollow cavity, and this forms the acetabulum, and the head of the femur articulates with the acetabulum to form the hip joint. The glenoid cavity and the acetabulum are these two cavities which articulate with the head of the humerus and the femur respectively. But the glenoid cavity is more shallow. So the head of the humerus, it articulates very superficially, allowing full movement of the shoulder joint, but it is more prone to dislocations. Whereas the acetabulum is a more deeper cavity, allowing the head of the femur to go inside. The forelimbs and the hind limbs together consist of 60 bones. Each forelimb will have 30 bones, and you are just supposed to remember the names. So there is a single humerus, the long bone, ulna and the radius, and the hand, the wrist, the carpals, 8, metacarpals 5, phalanges 14. Similarly for the hind limbs, single longest bone, that is the femur, which articulates with the tibia fibula, 7 bones in the ankle, the tarsals, 1 cup-shaped patella, that is the kneecap, 5 metatarsals, and 14 phalanges. So this is in brief, in short, that we are supposed to remember about the bones. It's a basic NCRT quick synopsis. We have not got into the details of every bone because this is a brief synopsis of the text that is there in the NCRT. For more detail, you can always refer our notebooks and the classroom lectures where every bone has been discussed in detail. But for a quick NCRT synopsis, this much is enough. The last part among the three, that is the joints. The joints are of three types: a movable joint, slightly movable joint, and the freely movable joint. The immovable joints, first of all, what is a joint? When two bones or more than two bones articulate with each other, meet with each other, that meeting point is called as a joint. अगर ये बोन्स के बीच में कोलेजन फाइबर्स है तो वो एक फाइब्रस जॉइंट बनता है जो मूवमेंट को अलाउ नहीं करता. इसके एग्जाम्पल में स्कल के सूचर्स आते हैं, स्टैचर्स नहीं, वो सूचर्स है. कॉम्फोसिस आता है, टूथ एंड सॉकेट वाला. Then the second type is slightly movable, cartilaginous joint. These joints, they have restricted movement between them. They show the presence of fibrous cartilage. They say the intervertebral disc that is between two vertebrae, it allows slight movement. Then the pubic symphysis, that is when the two pubic bones join with each other, the pubic symphysis, which also allows slight movement. They come under the cartilaginous joints. The most freely movable joint are the synovial joints. They can allow movement in more than one direction or sometimes only in one direction. These bones, they show the presence of a synovial membrane which secretes the synovial fluid, which acts as a lubricant and a shock absorber. और ये बोन्स को स्टेबिलिटी देने के लिए आर्टिकुलर कार्टिलेजेस होती है, सॉरी आर्टिकुलर लिगामेंट्स होते हैं जो दो बोन्स को ज्वाइन करते हैं, बोन को स्टेबिलिटी मिलती है. And there are articular cartilages at those places where the two bones meet each other. Two bones meeting each other, meeting surface पे articular cartilages होती है. Depending upon the shape of these two bones that meet each other, there are different types of joints, synovial joints, like the ball and the socket joint. Example would be the shoulder joint and the hip joint. The pivotal joint between the radius and the ulna, as well as between the atlas and the axis, the no joint, वो वाला भी, between the radius and the ulna, and the second example that I gave. Then we have angular joints, which allow back and forth and side to side movement, closer to the ellipsoidal joints. Gliding joints, जहाँ पे दो बोन्स एक दूसरे के ऊपर स्लाइटली ग्लाइड करते हैं, like the bones of the wrist and the tarsals. Hinge joints, which allow movement in one direction. इसके एग्जाम्पल में आएगा elbow joint and the knee joint. Saddle joint, जहाँ पे one convex head होता है, ball like, which fits into the saddle like depression of the other. इसके एग्जाम्पल्स में आते हैं carpals and metacarpals. So the saddle joint is present between the carpals and the metacarpals of the thumb. So you're supposed to remember the name of the joint and its example from the NCERT. The disorders that I mentioned are the first one, which is an autoimmune disorder, जहाँ पे हम हमारी immune system antibodies बनाती है against the acetylcholine receptors at the NMJ, neuromuscular junction, and that disorder is called myasthenia gravis. तो भले ही acetylcholine वहाँ पे रिलीज होगा तो भी मसल कॉन्ट्रैक्शन नहीं होगा, जिसकी वजह से मसल्स बाइट विथ टाइम थक जाएंगे, फटीग हो जाएंगे, वीक हो जाएंगे, एंड प्रोग्रेसिवली देयर विल बी पैरालिसिस ऑफ स्केलेटल मसल्स. लेक्चर के टाइम पे मैंने आपको बताया हुआ है, वन ऑफ द अर्ली सिम्टम्स इज एपिकांथी, जब आईलिड ड्रूप होती है. सेकेंड इज अ जेनेटिक डिसऑर्डर जिसमें प्रोग्रेसिव धीरे 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 देयर इज डीजनरेशन ऑफ स्केलेटल मसल्स व्हिच इज कॉल्ड मस्कुलर डिस्ट्रॉफी. देन द थर्ड वन इज टेटानी, जहाँ पे अनरिलेटेड, अनकंट्रोल्ड, वाइल्ड कॉन्ट्रैक्शंस होते हैं क्योंकि बॉडी में ब्लड कैल्शियम, बॉडी फ्लूइड्स में लो ब्लड कैल्शियम लेवल्स है. दैट्स कॉल्ड एज टेटानी. आर्थराइटिस इज बेसिकली जॉइंट्स में सूजन आना, इज कॉल्ड एज आर्थराइटिस. द नेक्स्ट वन इज ऑस्टियोपोरोसिस. ये एक एज रिलेटेड डिसऑर्डर है जहां पे बोन मास कम हो जाता है, देयर इज लॉस ऑफ कैल्शियम, increased chances of failure. Very common in females after menopause because of the low level of estrogens. Then there is a condition called gout or gouty arthritis, जहाँ पे there is inflammation of the joints due to the accumulation of the uric acid crystals. So this is the quick summary of the different disorders like myasthenia gravis, muscular dystrophy, tetany, arthritis, osteoporosis, and gouty arthritis. So this is what will help you to quickly revise the text before your tests. Thank you, Justin.